Hi there, so I'm back here at the office. There is a very curious case of a emergency CT scan for us to report. It's a chest and abdomen angiogram, aortic angiogram, and it says they are suspecting of it is suspected aortic dissection, and the doctor says here this patient has a missing arterial pulse on the left arm, and she also feels intense, very disturbing chest pains on the left in events. She has events of very acute chest pains on the left. She has gone through a heart angiogram, and there is no signs of atherosclerotic disease of the coronary. So this isn't really a coronary disease, but still she has left precordial pain and a unpalpable, a missing radial pulse. He also says she might have a aortic dissection that is compatible with such clinical finding. So I have already downloaded the exam because this is a very large exam, so let's not waste more time. And this is it. This is a contrast enhanced angiographic phase, and this is the pre-contrast phase. I'm going to roll the images and you guys are going to see all that I can see of this exam. So I'm going to roll up and down, and you guys pay good attention to it to see if you can notice any abnormalities. So let me just window this to be properly windowed. So this is the carotid arteries that are out of the scope of this exam. We are closing in aortic arc, some movement artifacts as always. This is not a very good exam as always, and we have gone through the entire chest section of the aorta a few times already. Did you guys notice anything? Just leave in the comments below. I'll be sure to answer any questions and reply to comments and whatnot. So let's go now to the abdomen. This is the infradiaphragmatic aorta. I'm going to roll up and down a few times so you guys can see if anything comes up. So iliac arteries, the visceral branches of the aorta, splenic and hepatic arteries, celiac trunk, or truncus celiacus, the superior mesenteric artery, right and left renal arteries, the inferior mesenteric artery right there, and the bifurcation. And we are done with the rolling of images. Did you guys notice anything? Just put down in the comments below before I actually tell you guys what's wrong with this patient. So let's begin right from the start. There is no dilatation, nor dissection of the chest, the thoracic aorta. Although we can see there are a bunch of signs of atherosclerotic disease. There is thickening of the walls, kind of irregular contours of the inside of the aorta, so the intimal surfaces are irregular, and there are some calcifications that we can see much better in the pre-contrast phase. So there is mild to moderate atherosclerotic disease of the aorta, but there is no sign of dissection. So the most important thing of this exam is ruled out, which is aortic dissection. As always, the abdominal part of the aorta is usually has more severe signs of the same disease on the chest, which is atherosclerosis. We can see here there is thickening, calcifications, and irregularities on the intimal contours of the aorta. This is a eccentric, very tiny thrombus, wall thrombus right here. This is a chronic disease for sure, but it is a unstable plaque nonetheless, so it's of concern. It could get worse at any time. But this isn't surgical, this isn't dissection. Also, there are the same signs of chronic disease on the iliac vessels. Common external and internal iliac vessels are mildly diseased, sick, altered, atherosclerotic, but this is it. Nothing major, no actual stenosis, no aneurysms. There is only one single artery for every kidney, so no multiplicity of kidney vascularity, which is the most common presentation, but it's really important to check for that. I couldn't see any aneurysms on the visceral arteries. You might be wondering why I just jumped from chest to abdomen, and you are going to know the motive right in a few moments, because the actual disease that justifies all the symptoms is right there on the chest, but we have to go through the entire exam before reporting the disease the doctor is looking for to justify the patient's symptoms. Just remember, the patient feels a left side precordial pain, a left-sided chest pain that comes and goes in acute phases, and she also has a missing radial pulse on her left arm. So there is something wrong with her left arm, left circulation on the chest. So usually you may have a dissection of the entire aorta, which will justify ordering a angiogram of both chest and abdominal arterial vessels. So mild to moderate atherosclerosis, no aneurysms on the visceral vessels. Usually the most common one is the splenic artery and the kidney, the renal arteries. There are no such disease here, which is fine. There is a peculiar early bifurcation of the right renal artery, which we are going to ignore, because this is just a variation, anatomical variation, nothing major. And as you guys can see, the external iliac arteries go through below the inguinal ligament and become external to the abdomen, and are thus called common femoral arteries, which is fine. So let's get to the actual motive for this exam that we can see right here, and I'll just roll over it on the MPR, and I'm curious to see if you guys can see it on the MPR. I have rolled over it a bunch of times, and I'm quite sure some of you can tell right now before I actually show it which disease it is, and if you have, please leave in the comments below. So the disease has shown up, and right now I'll just zoom into the chest. Yep, this is it. So I'll roll and the disease will show. Did you guys see it? It's right there. A bit slow. Why is her left arm missing a radial pulse? Why is she feeling a very peculiar pain on the left side of her chest? Why is that? Can you guys tell? So this is it. Let's go. This patient has a thrombosis of her left subclavian artery right here. The left subclavian artery starts off from the aortic arc right here, goes for a few millimeters, then goes thrombotic, completely occluded, completely devoid of opacification. This is a very common thrombosis of the subclavian artery. Although it isn't a common disease, this is a very rare angiographic presentation. I have seen a few cases before, so I always check for that, because once you saw it once, you can never unsee it. So this is a left side occlusion of the subclavian artery, and as soon as it receives collaterals from the carotid circulation and the vertebral circulation, it is re-opacified, it is perfused, it is irrigated, but by these collateral arteries. Although you guys can see right here, the vessels on the left arm are very tiny, are reduced in size if compared to the right side, and of course there isn't a large pulse, a large palpable pulse, because of this occlusion. So this is, as soon as she has some kind of increase in need for blood flow in this arm or in this left side of her scapular region, or is her left chest area, she will feel pain due to the ischemic event caused by this occlusion, and it will be impossible to check her pulses on the left, because this is usually a very slow dumped flow due to being created by this very tiny thin collateral arteries. So this is the cause of the patient's clinical presentation, and it's a occlusion of the left subclavian artery. I'm just going to show you guys right here on the coronal plane, which is the best way to see this disease, right there. So this is the occluded subclavian artery right there. Measure, it's about 2 to 3 centimeters of occlusion. 2 to 3 centimeter long occluded left subclavian artery. Let's just look at it on the sagittal view, which is a very peculiar way of looking at it because it's very, very easy to see if you follow it from the aortic arc. So this is the subclavian artery and it goes right there, it goes missing and then it shows up once again. So this segment right here is occluded right there occluded. Let me just make it really close so you guys can appreciate it. Oh, just there, you know. So once you have seen it, you will never be able to unsee it. So this is it. I'm just going to waste a couple of minutes reporting this exam. So if you enjoyed this video, I'm pretty sure you're gonna enjoy this one right here. Just click here and keep watching, and don't forget to hit that like button and subscribe to the channel. And until next time, I'll see you around.